It's Mari McInerney from Croakey here at ASMEAT 2024, and would you be able to introduce yourself, Bernadette?
Hi, thanks Murray. My name's Bernadette Byrne. I'm a radiation therapy clinical educator at the Launceston General Hospital in Tasmania.
And you've just been doing a workshop here before the conference proper, and you're also presenting though tomorrow. It was on neurodiversity. Can you talk about the main points you're wanting to get across here?
Yeah, I think the key points I wanted to get across is just a better understanding of what neurodiversity represents and some of the key presentations that people might see or might experience, and how that plays out for people who are diagnosed or sometimes undiagnosed but experiencing those. Also really important to look at trauma and how that links in with neurodiversity and how that can impact a person's experience with their neurodiversity, and then engaging with work and learning and just general life, social experiences.
Now, these are important issues in any field, but
Absolutely.
in what way are they particularly important in the medical radiation sciences for the audience that you're talking to here?
It's a really under-researched area, and it's, neurodiversity has become a buzzword in recent years, and it's become, there's awareness growing, but in terms of the medical radiation sciences, it's not something that we address as part of, diversity and inclusion programs in hospitals and those sorts of things. There's a lack of, understanding and awareness, and particularly in our hospitals and our clinical centres where we're working, it's busy. Everybody's running a million miles an hour, and the impact that can have on a neurodiverse individual, whether they're a patient, a student or a worker, is quite significant. And if we don't understand that, we're not actually servicing our people well enough.
Can you give an example of what sort of thing could happen or commonly does?
Yeah, sure. I guess one of the main things that people with neurodiversity experience is sensory overwhelm, and that can be in the form of lighting being too bright, too noisy in the spaces that they're trying to work and focus, and they can't get on with their jobs and do them well because it feels like their brains are being distracted in all different directions. And those sorts of sensory overwhelms can create extraordinary levels of anxiety in that person at the time, and if they can't find ways to manage that, we can end up burnt out with just overwhelming stress.
And you talked about simple things that people could do, or that you want people to leave these sessions thinking of how they can actually make workplaces or other health locations better. What are some ways they can?
Yeah, I'm talking about the sort of universal design for learning and how we can apply that to our workspaces, and looking at things like adjustable lighting, quiet spaces for people to work, changing our acoustic settings for the areas that we're working in, providing different methods of communication, modes of written format, visual format. Everybody learns differently and operates differently, and our brains process information differently, so we need to be able to provide avenues that's suitable for everyone.
And did you want to say at all what your personal journey has been to get you to this point here, to be a champion and neurodiversity advocate?
Yeah, I was diagnosed with ADHD just a year and a half ago, after quite a long journey with my son, actually, who after some time we were led to explore an ADHD diagnosis with him. He's now 14, and I think we've been on this journey for about nearly 10 years. I think when we started the journey of diagnosis with him, I started recognising that I had very similar challenges, and I'd always just put it down to, I've just got really bad executive function. But yeah, there was more to it, and so I explored it. And I you know, being an ADHD person, I hyper-focused and did a lot of research. And I think I just wanted to, I know the challenges that I had as a young person because it's been there my whole life, and particularly as a medical radiation student, the challenges that I had to cover because it wasn't something that I knew existed and certainly nothing I would disclose. I want to make that easier for the next ones coming through and anybody out there who's living with a neurodiverse condition.
And is it systemic change that's also required and cultural change you talked about? What are the biggest barriers to people actually enacting those sorts of changes that you're talking about?
I think it's a cultural shift. It's changing our workspaces so that they actually are more functional for people who have different needs, and work practices that are, you know, we're in very high-paced environments with, you know, clinical outcomes that need to be achieved, and we need to work for efficiencies, and it can overrun what the individual needs of the person are. It's a long process. This is not a short game, it's a long game, but I think if we can get out there and keep talking about it, and people keep learning about it and creating awareness, we can see some shift in the systemic barriers and perhaps make some progress towards a more neuro-affirming area that we work.
Fantastic, Bernadette. Anything else that you'd like to comment on?
No, but I just want everyone to have a great conference, so enjoy, and if anyone would like to reach out to me, please get in contact. I'd love to have a chat.
Fantastic. We'll put your details on this. Thanks so much.
Thank you.